Thank you, Jen. And good afternoon, everybody. Thank you for spending this time with us. I'm conscious it's getting closer to the end of the day. Hopefully you've had a good lunch and you've had a really useful day today. So hopefully that theme will continue with this session as well. So look, let's just take the opportunity now to introduce ourselves, if that's okay. So I'm Mike Naulls. I'm the UK growth leader for Mercer Marsh Benefits. And what does that mean? That basically means that I'm really focused on and looking after our clients, retaining our clients, growing our clients, and thinking about it from a consulting and broking perspective. So everything we would do to try and drive the right outcomes for clients from a consulting perspective. And I'm joined by my esteemed colleague today, Guy. Guy, would you like to introduce yourself?
Yeah, hi everyone. Do I need to press the button? Am I coming through? Just talk. Great. Yes, hello. I'm Guy Clarkson, so digital growth leader at MMB. Again, what does that mean day to day? So having grown up very much around employee benefits software, growing up at a company called Thomson's Online Benefits, naturally at MMB we have a much broader suite of consulting, well-being, all sorts of different services and solutions. So while digital is very much a focus of my role, it's also much more about how are we incorporating both the digital and the consulting elements. So a lot of the client conversations I'm having is around how we best drive value from the two. But yeah, good to be here, and over to you, Mike.
Thanks, Guy. So look, we thought it would be useful to perhaps, I guess, paint the landscape around the challenges that organisations, clients, and our country's facing in a way. So if we look at it from a socio-economic perspective, we know, broadly speaking, because there's independent studies that back this up, that the overall health of our society is declining. We know that from a organizational perspective and also from a personal perspective, we know there's cost inflation challenges. And even though inflation to a degree is being managed, that's still hitting everybody, both in a personal perspective, but also from a business perspective as well. Sickness absence levels are the highest they've been in 20 years. In fact, the last study by the Office of National Statistics confirmed this. That's quite a damning trend, to be say, to be the highest in the last 20 years. And that figure of 186.5 million is the amount of working days that was lost in 2022. And we're expecting that to be a consistent figure when the next set of data is released. We know that, okay, there's a new government in place, and Wes Streeting is obviously going to be looking at how we can make sure we can fix or look to try and fix the NHS. A broken NHS is the way he's framed it. But also on a personal level, we know that there's huge demands on the National Health Service. Just nearly over 7.5 million, nearly 7.5 million people are on an NHS waiting list. That represents 1 in 10 of the UK population. That's quite a startling figure. And at least nearly half of them are waiting for more than 18 weeks to receive treatment. So it's a real challenge when you think about the NHS's role in being the primary source for care for our nation and for our people. And then one aspect which obviously we're all really aware of if we think about our roles looking after employees and looking after people is the increasing challenge around mental health. And you can see from the stats there really a significant increase in the amount of referrals that are being made for mental health support, which just continues to also overlay in terms of the age demographic and the generational demographic of people. So there's a huge issue from a socioeconomic standpoint that really sort of challenges our nation and our people. Let's look at it from an employer lens perspective. And this has leveled out a little bit, if I'm honest, but if we were reflecting back on the start of the year and our role as advisors and our conversations with the insurer market and the provider market, we were saying to our clients, you should expect to see high increases in healthcare costs and in the cost for providing healthcare, whether that's an insured arrangement or a self-insured arrangement. You should be expecting and being prepared for high increases. Why is that? Well, there's still this bubble of treatment post-COVID. There's still this challenge around, of course, how do you support what is unfortunately a declining society in health that is impacting employees? And ultimately, there is an interesting shift, because if you think about it, with the NHS, in trouble, still needing to be fixed, the role of the employer has become more prominent. And what we're seeing is actually, if you're lucky to have private healthcare, more often than not, employees are going to use that. So that's an interesting situation. If you think about cost inflation, there's a cycle to that. So it's increasing care and increasing cost for a business. And of course, employees are demanding more from their employers, more from their benefits. And of course, that actually feeds the issue as well, because many employee benefits programs perhaps don't really reflect the true needs of the generational employee workforce. And then finally, let's think about it from an employee perspective. If you think about it, if they can't access care through the NHS, they're going to go through their employer arrangement. And I think for individuals, and even I've experienced it myself, it can sometimes be confusing. Where do you go for care? Where do you access the most efficient and optimized way to receive treatment, be looked after and get back to your normal health and be productive as an employee? So there is a challenge there in that benefits programs and the way providers are structured perhaps need to help optimize that treatment, ensuring that employees can navigate their care systems as effectively as possible. So those are some of the challenges that we're facing clients are facing. Let's. I think we're at the stage where we're going to have a poll before we get to that. You gonna do a poll? Excellent, Guy. I had your poll.
All right. So for those of you who are on Slido today, you can see the latest QR code. But yeah, just to kick off. So when thinking about your employees' health, so of these following statements, which best reflects your plans as an organisation for 2025? I won't necessarily read them all out, but if anyone's not clear, give me a shout. All right, I'll give it another minute or so. All right, so I think that's kind of stabilized. So yeah, look, we can see the top one there. So currently 65% are saying that we're going to maintain our current investment levels in supporting employee health. As Mike's touched on there, and we'll come back to, we know that it's becoming more expensive essentially to protect and maintain the current level of benefit in some cases, and perhaps that's where this 30% comes in to say, look, we know and we recognise, whether that's on a private insurance premium, or of course it could be wider employee wellbeing support. We've heard the NI news, of course, in the budget recently, and our clients having conversations about how they're going to cope with that. That'll heavily impact, of course, some employers, some more than others. So, where does that money come from, right? Is that taken then from a spend somewhere else? And a few people not sure. So, yeah, I don't think there's any surprises in there, Mike, unless you would disagree with me.
Well, it'd be interesting to see, to share some of the data from our Global Medical Trends Survey. But that's great to see, at least in this room, that you feel there's a commitment to maintain at least supporting your employees' health. You recognise the importance of that. So that's great. Thank you for contributing.
All right, so if we can just jump back to the slides. So here at Mercer Marsh Benefits, we do a lot of research. Hopefully you've seen it and you're aware of it. But I guess the thing when you do these REBA talks is they give you a fairly blank canvas, so you can actually talk about, within reason, pretty much what you like, as long as it's relevant for the day. So when Mike and I were preparing for this, we were looking at our different research pieces and things to try and anchor some of what we talk about in that. And actually our Health Trends 2025 survey that was released a couple of weeks ago, it is a global piece. It looks at different markets, it looks at employers and insurers in the different markets, but we're going to call on a few statistics as we go out, just so it's not just our opinion. People generally like to know what's going on around them as well. And actually, as part of the survey and the research, we then boil down into some big key themes that we start to see coming out of the surveys. And the way we'll present today is we're going to address each of these three items, so I won't get lost in them now. But firstly, it's managing intensifying risks. So, COVID was hopefully a once-in-a-lifetime thing. Of course, that kind of broke some norms. We're hopefully through that, or we are through that post-pandemic phase. So actually, if you look at the trends, you look at the reasons, the medical conditions that have been driving cost, driving claims, driving the reasons people are absent, etc., they've actually been fairly consistent in terms of type, but we are seeing, as per Mike's earlier slide there, that they're increasing. So this is the Future Forum. You know, we do want to look forward, look for some innovation, some, you know, what else, but also we want to give you some actionable ideas here, so keep your eyes out for those. But ultimately, there is a lot of movement in the market now to explore and use new techniques to keep plans affordable. And again, it could just be a private medical insurance premium, but it could also be those supporting services as well. You know, there are so many levers that brokers, consultants can pull to control costs, but ultimately you run out of levers eventually. So we will talk to some of the techniques that we're seeing. And then meeting persistent workforce needs. So look, for those of you who've been at these events, either the summer wellbeing session or last year's Future Forum, you know, medical coverage, we've talked a lot about wellbeing in a holistic way, and I think that there's more that employers can do there as well to really recognise the diverse healthcare needs of their people. So we will address them one by one. So if we can just click on Mike, thank you. Those of you who've seen me present before might know I like a quote. Lots of quotes out there about innovation, actually. But Theodore Levitt, so he was a German-born American Harvard professor. But he quoted this, and I insisted to Mike that we have a quote in, and we agreed on this one. Well, but look, creativity is thinking up new things. Innovating is doing new things. And I think that for today's session, we could have said, look, if we started with a blank piece of paper, how would we completely redesign healthcare in this country, employer-funded healthcare, etc.? But ultimately, I think this is more, it's evolution, not revolution. I think that's some of the themes that you will see from today's session. So anyway, we may come back to that quote, but please remember that as we go through.
Thanks, Guy. Okay, so look, our first piece, if we go back to those 3 risks, was about how do you manage some of those intensifying risks? I'm conscious that this slide has got a bit of detail on it, but what I like about this slide is because it's rooted in Mercer's own data. It's probably about 3 or 4 years old now, but we have also used some of this data with our own population, so our own people, plus also our clients, and also we were in partnership with one of the medical providers as well, so it's also rooted in a lot of data around employee populations and the health risks that are inherent with them. And what was really interesting in the data is that for most organizations, you will find that they'll have this demographic. So if I draw your attention to left to right, what we find in most employee demographic organizations is that you'll typically have about 15% of employees that are well, they're at work, they're productive, it's all good, it's all tickety-boo. And then as you move left to right, you'll have this big group of employees, 55% that are particularly at risk. Now that could be a health issue, it could be, some of the examples you can see there, smoking, obesity, stress, they're pretty obvious. But the truth is they are, as a demographic, potentially at risk from going off sick. And then if you look on the right-hand side of the slide, what we again find in the data is 25% of employees will be making use of their benefits. It would may be a short-term, acute phase of a medical condition that gets them back to work, but the reality is that they will be making use of their benefits. They're ill. And then on the far right, there will always be roughly around 5% of employees who will be on long-term sick. The interesting point is most organizations, when they think about how they focus their spend and how they focus on mitigating risk, it's more often spend is focused on the right-hand side of the slide. So it's reactive. And if I just build the slide a little bit, the ways in which organizations try to tackle that is through traditional means, which is what we do in some respects, going to market, trying to sort of ensure that we get the best possible price for our clients, more traditional broking type activities. And of course, what happens on the left-hand side is most organizations, although they've moved the dial in terms of looking at wellbeing programs and putting in place wellbeing programs, the truth is that it's still fragmented and there's no coordination between the two. Now, of course, this isn't necessarily a new story for most organizations, but the truth is that we're still seeing this pattern. Even when we continue to work through the data, organizations still find that they are focusing too much spend and too much activity on reactive health type problems. And what needs to happen is there needs to be an end-to-end ecosystem. There needs to be a different type of approach. And I know this seems quite simplistic, but if you're finding that the challenges around continuing to provide value for your employee benefits and your health spend is continuing to increase, keep doing the same thing, just traditional broking, isn't going to solve the problem. So actually understanding the drivers that impact employee health, understanding the data, and then putting into practice processes to try and manage that risk better is the right way to do it. So look, again, consciousness is not necessarily a new message, but it's still very much the pattern that we're seeing that clients it's still the approach that clients are taking when they're trying to manage their costs and their employee spend. Guy.
Over to me. So again, as Mike and I prepared for today, and this piece actually comes from our people risk report that we do with our colleagues over at Marsh. And actually, while we are going to talk about controlling things like insurance costs, the investment that people can make into solutions around mental health or financial well-being, all these great point solutions, some of which you'll have seen today exhibiting. Actually, for me, I think there's another way to challenge ourselves as employers. And actually for all, and it's per Mike's last slide really, for all like, oh no, someone's in that unwell phase, or we need to do something, we need to intervene, we need to get them healthy again. Actually looking at the triggers and the stresses and the pressures, as an employer, we control a lot of those in theory. So you can see on the slide, I won't go through them all in great detail, but reasonable job requirements, planned scheduling and reasonable hours. And I was reflecting on this in terms of me personally, and I don't know about you, maybe when you've had a week holiday, dare I say you stretch it to 10 days, I almost get that bit of dread as to maybe what I'm going to come back to and things. And I stopped and reflected on that and thought, well, if I said to my boss, I've had a super busy week, I was presenting at REBA yesterday, do you mind if I take some time off tomorrow? Then I'm sure he would say, yeah, take the whole day. But then coming back on Monday, it's not like Friday's work was done for me, right? So, it got me thinking, and we were discussing this, and I don't want to get too lost in that idea, but I do think as employers, where we are thinking about what we can change, how can we innovate the way we're doing things, yes, of course we need to look at what benefits we offer, the provisions, the insurances, but actually maybe as an organisation, and this isn't all on reward and you guys, but how are we supporting managers in that conversation? If colleagues are too busy, getting a bit burnt out, what can we genuinely do to alleviate some of those stresses and pressures, as opposed to saying, oh, yeah, guy's gone a bit over the edge there, now there's something to fix, right? So, look, maybe it's one for a future session, but just something maybe to think about. And again, the one that really jumps out for me is reasonable job requirements. We all probably know people, ourselves and our colleagues, who they're just too busy a lot of the time, and what impact is that potentially having on their well-being as well?
Okay, so I was intrigued by the first poll response, which was actually that you said that majority of people in this room would look to maintain current spend levels in their employee benefits and their healthcare spend. This is a data cut from our latest MMB Health Trends report. Now, this is a global report, but I'm conscious some of you in the room will be working for a multinational, and therefore obviously that has still relevance as well. And of course it has UK data in there as well. What I think is really interesting is that when we were surveying our clients on where do they, would they continue to support and drive more benefit plan improvements versus managing cost? You can see from the slide that actually over the last 2-3 years, more organisations are saying, well, actually, we can see cost extended, we can see cost being a problem. So actually, we might have to try and reduce down potentially some of our benefits, manage our costs more effectively, and that does have an impact. Now, plan improvements doesn't necessarily always mean adding more benefits and more spend. Plan improvements could also be making sure it's as optimised as possible, and that's really, I guess, where I'm coming from this. I'm conscious this is a future forum, so I don't really want to dwell too much on what is the current state. But the reality is that I think as organisations and employers, you have the opportunity just to take a step back and make sure that you're doing the basics right. So that is, clearly about making sure that you've identified what the risks are, what your benefits you've got, what's working and what's not working. You can analyse and assess and make sure that actually has it optimised as much as it's possible. And then the responder control piece is actually doing something. So you've got the opportunity to either work with an advisor or maybe with your providers to try and affect real change. And then finally, of course, it's continuing to monitor and review. Pretty basic stuff, to be honest. Everyone in this room will know that. But sometimes it's just worth reminding clients that we can do that. And that also then just sets yourself up really for success. So what are the 3 things we would kind of just point towards? Well, I think as employers, you need to think about 3 main risks. One is utilization risk. If you know your data, if you know how your plans are performing, that gives you the opportunity to look at design coverage, that looks at plan implementation and plan improvement. And I think, sometimes the usual levers of, co-pay, co-insurance, hospital network steerage, benefit limits, they are traditional cost control measures, but they shouldn't be discounted completely. They still are relevant. The question I think you have to ask yourselves as employers is, do they meet the needs of our employees, and are they still relevant? So I think there's a piece there about employers thinking about the relevance and the value from managing some of those utilization risks. There are health risks, and I mentioned earlier, obviously you saw the slide on employee populations, which we call the wellness barrier. Clearly understanding where your health risks are and how you can best manage them is really, really important. And I think, again, that's where advisors can help you by drilling into the data, by really helping make sure that whatever your plan design is, or your healthcare benefits, it is optimized and as effective as possible. And then the final one is about supplier risks, because the truth is that actually with many suppliers, you've got multiple coverage. And I'm conscious even in Mercer Marsh Benefits world. If I take a step back and think about the plan coverage that we provide to our own employees, sometimes that can include, for example, telemedicine across 2 or 3 different providers. And the experience for an employee can be different depending which route you take. And the cost is different. So we've had to actually learn from our own medicine, and our own advice, and actually make sure that we bring optimization into the way we deliver benefits for our own people as well. But managing that supplier risk is, again, another way you can do that. So look, that's the kind of easy stuff in some respects. The future could be more exciting, and I think this is where you're picking up, isn't it, Guy?
All right, I don't think you were allowed to do a talk today without at least 1 AI slide. So I've got 2, but here we go. So if you just give it a quick click, Mike, thank you. So look, AI is all around us. I think outside of the workplace, everywhere you turn, it feels like we hear about it. But what I found interesting, and I'm a bit of a budget geek, so when Rachel Reeves stood up to deliver her budget, she was up there for about 47 minutes or so. I think beforehand, I was always thinking, I wonder what she's going to say about AI. She actually mentioned it once, and she mentioned it in relation to the NHS. But I think like a lot of us, and we'll come on to the employer side of things, but we had a client event on Tuesday, and I was talking about AI in terms of our Darwin benefits software. And I was chatting to clients, and I think a lot of people are still figuring AI out in terms of what it means to them, their role, their day-to-day life. Not many of us is it fully integrated into our day-to-day lives yet. So when we think about AI from a general healthcare perspective, so where Rachel Reeves looks at the money going into the NHS, what are we going to do with it? Oh, AI got a mention. An AI thought leader also said, you don't just put AI into the NHS and suddenly the NHS works, right? It's clearly not that simple. But the areas they will be exploring are some of these things we can see in light blue here. So operational efficiencies, administration, triage, we can see use cases and start to feel use cases already. The imaging thing, so I read a piece about this ages ago, but the ability to actually quickly and more accurately look at scans, for example, AI is already doing that, but if that's then freeing up doctors' time, and also freeing up administration time, don't forget as well, it's going to make healthcare more efficient and arguably more successful. AI is already better at looking at scans and identifying issues than the human eye. They still have a human look at it, don't get me wrong, but it's a validation. Personalized medicine, so tailored treatment plans, delivery of those plans. We know that, there are lots of medicines out there that you can have different doses, different strengths, take them for different amounts of time. AI has a great use case already and multiple use cases to really start to tailor that. And then predictive analytics. And actually, it was nothing to do with the NHS. It was actually Amazon I was reading. They can look at what people are buying, and not just healthcare stuff, by the way, and actually start to predict health outcomes. Again, Amazon being Amazon, they've got a ton of data, right? So I think predictive analytics is probably still in its early phases, really, but truthfully, I think all of this is. So that's what's going on in more the general healthcare space. I think as we look at it as HR reward benefit professionals, we are looking at advanced analytics, so helping benefit professionals, leveraging that data, and actually hopefully answering some questions, again, for the consultants to validate the answer of, not have to start with a blank piece of paper. I know there's one of the providers here today have talked a lot about benefit navigation, so the really, I suppose, breaking benefits down and making sure that relevant, tailored, personalised recommendations are being made where an employee interacts with that benefit programme. You know, depending on the organisation, people might get lots of benefits, they might get relatively few benefits, but within benefits, you often get a lot more benefits than you realise, put simply. Communication, so again, I've been doing this a fair while, and I think most clients would like to communicate probably a bit more with people, but they're also very, very conscious they want to communicate about the right things at the right time and protect the integrity of that communication. And what I mean by that is, let's not just send something around middle-aged men's health to our full population or something about menopause to our full population. Let's send relevant, tailored communications. The simple logic being, if the last one was useful, I'm far more likely to read the next one. And then finally, customer service. So again, this is something we're working on with our own Darwin platform, something like a chatbot, for example. Now, you'll have heard perhaps about chatbots elsewhere today. We've been quite cautious about chatbots because, you know, how many people have used a chatbot? Lots of us. How many people have probably had a less than great experience with one? I would wager lots of us as well. And, you know, I think it's very emotive, isn't it? People's health, the family members' health, to have a really bad experience with a chatbot when you're trying to figure out how to make a claim for one of your children on the medical policy. You know, that's a moment that matters for us. So I see great use cases again for it, but I also see, as you can see in the middle of the slide, it's about managing and acknowledging those risks as well. So look, like I say, AI is all around us. I think that as employers, your employees will benefit away from the workplace as the NHS and others get organised, but also look to us, talk to us as the advisors, the platform providers, as to how you can leverage what we're doing as well. And on the insurers, so look, I've worked in the insurance space. I know you have, Mike, a long time. You know, some of the insurers are quite big old beasts, dare I say. You know, they have a lot of legacy policies, systems, platforms. It really interesting from the survey that we did, again, the 25 health trend survey. How are the insurers leveraging AI? Because you as their clients, we as the intermediary, we want to know that, right? And that might start to actually shape our recommendations or indeed the decisions you're going to take as the employer. So, and this was a very early one, this 48%, not surprised to see that at the top, is how they're leveraging it to detect fraud, waste, abuse. So, you know, there's a lot of wastage in these schemes, and unfortunately all that happens is the cost of wastage gets loaded back on top of policies. Claims analysis, so I mean, look, we've probably long manually been doing this as an advisor, and I still think there's a key role for us to play, but leveraging analytics to look at claims, that's a very obvious place to start as well. Health risk management programs, so again, we're in kind of the 20%, probably in that more kind of, not quite nebulous phase, but actually tailoring again, back to that last slide again, more personalized AI-driven health risk management programs to the individual member level. And then again, look, it's either going to be a platform doing it that you're already using, but to help employees, help individuals navigate, find the parts of different policies that are particularly relevant to them at that moment in time, or may be relevant in the future, but telling them about it at the right time in the future. So yeah, we just wanted to put that in there as well, because again, if I'm you guys out there, I want to know I'm working with an advisor and a platform that is taking this stuff seriously, but also I'm starting to maybe think about my insurers and what they're doing, and that becomes a key question that I'm asking as well. This is still me, Mike, isn't it? So Yeah, so look, how are we doing on time? 11 minutes. Right, so third of 3, this is the meeting persistent employee needs. So look, like I said at the top of the session, we know that these trends and risks are intensifying. We know this levers being pulled, but ultimately we just wanted to finish the session on and give you a few actions potentially to take as well. I hope you've enjoyed what we've talked about. You've heard lots from different people as well, but we were determined we want to finish on some actions, so let's keep going. Again, as I said, my background is really employee benefits software. That's kind of where I started. And this has kind of long been a thing that, look, if you better communicate benefits, you put them all in one place, employees are going to typically have a more positive perception of it. And this was taken actually from last year's Health Trend report, from this year's, should I say. The first one, tailoring, choice, personalization. But secondly, particularly relevant, I think, for today, the platforms have evolved, right? They used to probably be an annual transactional, buy your holiday, flexi benefits, whatever you were doing. But actually we're weaving now in much more that wider employee value proposition. Health and well-being, of course, being a very key part of that for many organizations, but a very strong correlation you can see there. And then look, this link about thriving in current role, current organization. Thriving, I think, I always find it an interesting word. You know, we might define that slightly differently as people, slightly subjective, I guess. But again, it all starts to paint this bigger picture, and we'll touch on technology as we go. But Mike, if you give it a click. And this is where communication comes in for me. So those of you, I don't know if anyone in the room was in the session I did in the summer, but I talked about some of these areas. But for us, it's about creating and communicating holistic approaches. We haven't had time today to get lost in the different pillars of well-being, but you know, we know certain mental health is a big challenge. Yeah, financial pressures have been a major challenge for a lot of people in the recent inflationary environment. Ultimately, it's about bringing it together. It's about being holistic and, crucially as well, giving employees access. Then we think about leveraging data. I've touched there on targeted, tailored, relevant communications. These platforms know a huge amount about the employee, so if we can harness and leverage that to make sure, again, we're talking about the right things at the right time. Consolidation, so many clients we work with, especially through COVID, were layering in more and more of these seemingly great solutions around well-being, and a lot of them are great solutions, don't get me wrong. But I think that it became a bit of an untangled mess in some cases, and people were struggling perhaps to find the thing they needed at the right time. So again, technology by its very nature will bring things and put them in one place. And then look, finally, and this is a big one, right? How do we even know this stuff's working? We can communicate, we can tailor. Actually, long term, I think the true measurement of this is, are our people more well? Or, you know, are we seeing those sickness rates go down? Are we seeing our claims coming down on our private medical insurance and other policies? And there is another little quote. But yes, let's go on to personalised care, because I'm conscious of time.
I am conscious of time, and I don't want to keep you from your next session, so we're going to move very quickly through these. We talked a little bit about personalising care pathways. And what I mean by that is about thinking back to my slide, which had the wellness barrier with the different percentages of employees. Earlier intervention, and changing from what is a reactive type approach to benefits and healthcare spend to something that allows you to actually think about understanding what the data is, understanding what the challenges are around your employee health workforce, and intervening early is a really important tip for us. So, you know, I think that's a good way to do it. And look, we talked a little bit about the benefit landscape, and particularly around healthcare, making sure it's connected and clear so your employees can navigate that as best as possible. Digital platforms gives the opportunity to enable that, so that's very, very clear there. And I think as people managers have a responsibility and a role to play as well in helping obviously ensure that their people can get access to care and support wherever they need. So it's just simplistically making that journey for an employee when they need care as quick and as easy as possible. So, if there's only 5 things that you do from today, we're on the home run. It's a bit of a negative one, number one, but I think the truth is that you've got to be prepared for increasing costs. Okay, everything we've shared today is perhaps not necessarily new to you, but the truth is the scale of the cost of increasing challenges around healthcare in society and also in the UK and accessing care is going to be a problem. And employees are going to be using their employee benefits more often than not, and that means the added cost into that cycle around providing those benefits. It's still a really important benefit, but you need to be better prepared for cost increases. So if you think about the risks and that will come with that, understanding your data, understanding what's driving healthcare costs within your employee population is incredibly important, because that will allow you to do more targeted work around ensuring that actually your advisor and your providers are really managing that cost appropriately. And then, of course, thinking about how those healthcare offerings are as inclusive as possible, but they're funded in the right way. We haven't spent too much time talking about financing options, but of course, there are different ways in which you can finance and manage the cost of your employee benefits depending on your appetite to risk. And I think, obviously, Guy, from a digital perspective, there's also things that you can do.
Yeah, and look, digital's a big thing, isn't it? There's digital within the policies. The insurers, I think, have massively stepped up their game in terms of the digital solutions that they're offering, whether that's their own websites, which frankly many weren't great, but then things like virtual GPs, just the general well-being apps that you see. So always talk to the advisor or talk to the insurer about those. Make sure you're aware of them and you're communicating those. And ultimately, it brings us on to number 5, right? You know, whether you're working directly with insurers, then that's the choice you take. You can press them harder. But ultimately, as advisors, that's our job as well, right? Like, let's step back, let's have a conversation, explore some of the areas we've touched on today, and continue to pressure them, right? This is about value for money, ultimately, from the spend, whether that's still going to be creeping up. So let's work as hard as we can with the insurers too.